Cransley Hospice is an NHS hospice, but the NHS relies on in the region of £550,000 by charitable donations. So my role is to ensure that money comes into the pot. A lot of our money comes from in-memory donations because of the work we do. We have a lot of money from legacies, but we do lots of events ourselves. We can charge £3 for a ticket to come to a night out, or our summer ball is nearly £50. We do keep fit events, we've got our road race, people can walk, people can jump out of a plane, and we'll help them organise that themselves. Sometimes the best job is opening the post, in that we don't know what people have done on our behalf until we get the money. So whatever money is donated, be it £5, be it £5,000, we try and tell the donor what that money could buy. What makes the difference to the patients we care for is the staff. And some staff positions are now funded out of the charity. For example, an OT post, the lymphedema nurse, the welfare rights team are a lot of those posts are funded out of the charity. It is about salaries and people's roles within the hospice, because it is them that makes the difference to the patient.
I decided to set up the SelfSoothe box project as a response to working on the dementia assessment unit and seeing that there was a need to have a communication tool that could be accessed quite quickly by anyone. SelfSoothe boxes are a little bit different in the fact that they've got things in there that soothe someone when they're distressed, that facilitate conversation. It's those small snippets that make an experience valuable. You can really get the essence of who somebody was. We had a gentleman who had a little green tank and nobody knew why. He'd never talked about his war experience, and when that was put in his hand, he just started talking about very funny stories, not sad, very funny stories about things that had happened, and he was a tank driver in the war, but nobody'd known that. When they're doing special ops, instead of sitting with the patient and not having any knowledge, if a bank staff member comes on, they can get the box out, they can instantly access lots of things to do with that person. So you can use that in your everyday communication where someone with dementia may not be able to tell you.
When I first came to the Trust, we decided to talk to our colleagues, talk to our staff, talk to our patients, talk to our consultants, our GPs and commissioners, and find out what they wanted from the service. Our staff wanted less handovers. If they had a patient that they felt needed further investigations, they didn't want to have to put that patient on a separate waiting list. They just wanted this to be a smooth flowing service. So we've now gone on to a centralised electronic booking system.
Hello, I'm ringing to offer you an appointment.
The electronic booking system allows us to be able to offer a patient an appointment anywhere within the whole county, and it allows them to have one integrated waiting list. So you could live in Northampton but you could work in Corby, and you now have a choice. Do you want to be seen in Corby or do you want to be seen in Northampton? So there's flexibility for the service.
We've got one tomorrow.
Waiting lists have come down from a maximum of 36 weeks to an average of 5 weeks. That's exactly where our service should be, and we're really proud of our achievement there. We deal with everything within the service. We don't need to keep referring back to GPs. We're trialling text messaging our patients. It's a really useful reminder, especially if your appointment's 5 weeks from the time that we contact you. We also feel that we're probably a lot more cost effective, so we're actually benefiting the whole wider service. Nothing's difficult. You need to talk to your service users, you need to find out what they want, then you need to look at how you can put that in place.
About 3 years ago, we decided that it would be a good idea to bring clinical training back in-house in order to ensure quality, but also to be able to develop a service which would enable us to advise staff as well as provide training.
Hello there, Tom. Are you all right? Open your eyes for me.
So we began to deliver basic life support, immediate life support, manual handling and safeguarding training in-house. We deliver training both at generic venues where people can book onto the course, or go out and deliver dedicated sessions to staff. We're also able to go out and offer advice relating to particular service users if staff are having particular problems or concerns with them.
Okay, so first of all you're going to check the area is safe for you to approach.
So it's benefiting staff in terms that they are receiving good quality training. We know that they are all receiving the same level, the same standard of training. It's benefiting service users because they are receiving care from staff who are trained and competent in the roles that they're carrying out. It's saving money every year. Instead of having to pay out for external trainers to come in, we're able to provide the service in-house. This has given us, we've calculated, a saving of around about £100,000 every year, which is able to be ploughed back into other training services or indeed other clinical services to directly benefit patients.
We work with people with learning disabilities who live in the community in their own homes. Part of our work is developing skills around healthy lifestyles. We started off working with clients that had all moved into a block of flats, had their own flats each, but were becoming sort of quite socially isolated in the evenings. We took a couple of clients shopping and in doing so developed a pictorial shopping list with them. We also worked with doing recipe cards, taking pictures of the process right through from start to finish, including the actual ingredients they would need for the recipes. Having watched Come Dine With Me a lot myself, I thought the clients might quite enjoy the experience of being filmed, doing the whole process and actually inviting their friends round to eat a meal with them that they'd actually cooked for themselves.
Hey Jerry. Hi.
They are actually all now socialising a lot more with each other and doing a lot more for themselves. It's clear that they've got a much greater knowledge of what is good for them and what isn't, and are able to make better choices for themselves. At the end of the Come Dine With Me experience, we weighed our clients and we realised that 2 of them had actually managed to lose a little bit of weight. They just seemed much more comfortable about living where they were living, knowing that they'd got friends within their flat.